We interrupt this program for breaking news from the Global National Newsroom.
Hello, thanks for joining us on TV and online. I'm Robin Gill. We're waiting for Prime Minister Justin Trudeau to deliver his latest update on Canada's response to the COVID-19 crisis. You're looking at the door of Rideau Cottage, the Prime Minister's home in Ottawa. We'll take you there in a moment. It's a site that has become familiar to Canadians each and every morning now for nearly 3 weeks. The Prime Minister is expected to speak outside in about 15 minutes. Here's how things stand with the number of cases in Canada, starting with some good news. At least 2,300 people who tested positive for COVID-19 have recovered so far. Sadly, 187 people have died. Overall, there have been more than 12,500 cases in Canada, and here's a snapshot of how that number breaks down across the country. More than 6,000 cases in Quebec, the highest of any province, 3,600 cases in Ontario. Alberta and BC both have over 1,000 cases. Yesterday, public health experts in Ontario laid out in stark terms what their disease models project. These are projections, not certainties, and they are best and worst case scenarios. Up to 100,000 deaths in a pandemic that could last 18 months to 2 years. Now that's if no measures were put in place to slow the spread. Of course, there are measures in place. The economy has been virtually shut down, and everyone's been told to stay home and stay physically distant. Now, if that continues and we all obey the public health measures, Ontario projects its death toll anywhere between 3,000 and 15,000. Let's bring in our chief political correspondent, David Akin. David, those are very worrisome numbers that Ontario is projecting with this pandemic and suggestions that it's going to go a long time.
Yeah, they are. And there's a couple of reasons that I think Ontario wanted to release those numbers. First, Doug Ford, the Premier, saying earlier this week he believes that Ontario citizens ought to have the same data that he's being presented every day. And so he just felt that was important. But there's some reasons to do this. There's some other reasons as well. First of all, I think Canadians, Ontarians, are ready to make sacrifices, the kind of sacrifices we're doing now, and they want to know what is the goal. And so these best case scenarios whereby we see a radically fewer number of deaths, albeit more deaths, that's what we're trying to aim for. And if we don't take these measures, or even if we keep the same measures, we're looking at increased deaths. You mentioned some numbers over the long haul. Right now, Ontario has 67 deaths recorded. Keeping things the same way, from 67 goes to 1,600 deaths by the end of the month. That's with everything staying the same. If there were no measures, we could be looking at 6,000 deaths at the end of the month in Ontario. The Premier now, the goal of the Premier and public health officials, we've got 67 deaths in Ontario now. Can we keep that to a couple of hundred? And that means possibly some more radical measures are going to be required. The Ontario Premier yesterday essentially cancelling non-essential construction, no more residential construction. So that's one way to do it. And I suspect you're going to see a lot more aggressive enforcement. Here in the national capital, here in Ottawa, bylaw enforcement officers have been told we're past the point where it's a polite warning if you're seen in a park or in a group, or you're out with a group setting. It's going to be $800 fines right off the bat. So that, again, people hope will really enforce things, that these rules are saving lives. There will be pressure, though, Robin, on the Prime Minister, who's resisted a national forecast, a national model. What is the worst case and best case nationally? Yesterday, the Prime Minister is saying some of the provincial data was not as reliable, and he doesn't want to release anything without reliable data. But again, seeing what Ontario has done, and BC and other jurisdictions, you can expect the pressure will continue on the federal government to release similar models.
But there seems to be this pressure on him not to create mass panic. I think that he's trying to tone things down. Let's talk about what's happening on the West Coast in BC. How do the numbers there compare?
Yeah, so BC, I think a lot of Canadians were a bit encouraged to hear the latest numbers from BC. And for those not there, here's what happened. Yesterday, Dr. Bonnie Henry, the BC Provincial Officer of Health, said that the overall number of hospitalizations, I should say, and overall number of COVID-19 cases in the ICU dropped. The curve dropped, and that's the first time in weeks we've seen fewer people in hospital because of COVID-19. That's a good sign, and we hope it continues today and in coming days. But again, the message from BC authorities is we got to stay doing what we're doing. This is What the drop we're seeing now is because of actions everybody took really probably 10 days to 2 weeks ago. So we keep doing what we're doing now, and we'll see further results 10 days from 2 weeks. It was interesting to note the health minister in BC, Adrian Dix, yesterday, he's asking the federal government to be more aggressive with border controls and border grilling. Lots of snowbirds are returning right now from the United States, where we know there's a huge outbreak. And Minister Dix is saying the federal government needs to step it up in making sure that there's no sick snowbirds coming home. Snowbirds have the correct information about the quarantines that are mandatory here in Canada. So I'm sure that's something that the Prime Minister is going to be asked about when he comes out of Rideau Cottage in a few minutes. I should note, it's a lovely day here in Ottawa, and I'm listening to forecasts in some parts of Western Canada. Winter has still got an icy grip. It's going to be 13 and sunny, and we're starting to see tulips start to pop out here in Ottawa.
Oh, something positive. Thanks for that note, David. It's been really cold here on the West Coast. Late yesterday, though, the U.S. Centers for Disease Control changed its stance on face masks, recommending the general public start voluntarily wearing them. We should also point out that the CDC recommended people wear cloth masks, not the surgical mask or the N95 respirator masks that are in high demand and short supply. David, do we anticipate any change in recommendations here in Canada when it comes to that?
So the politicians, and I think this goes federally and provincially, have been deferring to public health authorities on this matter. And when the Prime Minister's been asked about it, or the Health Minister, they turn to Dr. Theresa Tam, the Canada's Chief Public Health Officer. She's been asked about this quite a bit over the last week at the briefings that the ministers give, and she gives usually around noon Eastern. And her advice generally is, well, it can't hurt, I suppose, but they're not recommending it at this point. And as Tam has explained it, you can introduce more problems than you may think you're solving if you have a general order to the public to wear a mask, even a cloth mask. And that's because, as Dr. Tam says, you end up trying to adjust the mask, or you may not have it on. And every time you're putting your hands closer to your face, that's how this virus infects people. So if you're adjusting your mask a lot, or you're touching your face a lot more because a mask is on it, that introduces or heightens the level of risk. So it's important that you know how to wear a mask. That it's got to cover the nose, it's got to cover all parts. If you've got a beard, a mask may not be the most effective thing because stuff can get in around the beard. So this discussion is going to continue with the CDC, of course, is the world's biggest public health authority and among the most expert, I suppose. Canada's got a very good public health agency too, and is obviously reviewing the data. And I'm sure Dr. Tam, or whoever is going to speak on behalf of the Public Health Agency today at the noon Eastern briefing, is going to be asked about, well, where are we, given the CDC has now said you might want to be out there wearing a cloth mask. It's a hot topic, there's no question about it.
Still with the topic of masks, the Prime Minister is expected to address talks with the U.S. over exporting those 3M respirator masks to Canada. Where is that at now?
Yeah, so there might be a little bit of wiggle room. Late last night, the White House released a statement essentially explaining why it has asked 3M to cease all exports of the N95 masks to Canada and to Latin American countries. And right at the bottom of that statement, the White House says, this order doesn't prevent any exports of protective gear, should that be in the interest of U.S. foreign policy or U.S. interests. And that is exactly the tack that the Prime Minister said he would be taking with the White House as they try to explain to the United States and explain to the White House that Canada and the United States have such a tightly integrated, not only just economic system, healthcare system, that this in the long run will likely do more harm than it might do any good. Here's an example, Robin. In Windsor, Ontario, 1,500 nurses and doctors live in Windsor, Canadians, and they go to work every day in Detroit, Michigan. That's just one example of how Canadian resources are helping to keep Americans safe, and presumably you would think our closest ally wants to make sure that Canadians are safe. 3M also warning here that America, the United States, opens itself up to retaliatory measures by other countries who make some of these N95 masks. And if they retaliate, the end result for the United States would be fewer N95 masks. So it would be working against whatever White House objective there is here. So again, there's that little note saying if the White House thinks there's better in our interest, then they will, exports can continue. My sense, Robin, is looking at some of the reporting in the United States, what really prompted this from the White House was not so much the actions of 3M, but some of the distributors, some of the resellers of these masks that were gouging prices. And I think Trump is trying to get at those people. So if 3M and other authorities can crack down on some of these price gougers, perhaps again there might be some movement by the White House.
All right, David, we're going to get back to you after the Prime Minister speaks. Let's go to our Ottawa Bureau Chief, Mercedes Stephenson, who is working from home. Mercedes, let's talk about military planning. Where is that at now with this pandemic?
Well, we learned yesterday, Robin, that for the first time, the Canadian Forces is activating in response to a province as part of they are calling Operation Laser. Operation Laser is the code name for the operation of the Canadian Forces operating at home in support of provinces, cities, or the federal government when it comes to the COVID-19 crisis. Now, this initial deployment is going to be quite small and quite limited. The province of Quebec has asked for help in some remote communities like Nunavik, where there has been COVID-19 detected and they are worried about the spread. Right now, it will only involve the Canadian Rangers. You would recognize them by their very distinctive bright red sweatshirts that they wear. Many of them are Indigenous Canadians from the North. They are in the military. They help to patrol. They help to feed back intelligence and to provide expertise about working and living in Canada's far north, as well as carrying out their military service. So they've been asked to go to these remote communities in Quebec and to help do things like set up reception tents and logistics tents. They're not going to be setting up field hospitals. It'll still be the local healthcare authority and local capabilities that are doing that, but they're going to help set up an area that people can be received into, because at this point they're expecting more people to need attention, more people to need care. Obviously, it's still very cold outside. You don't want people waiting in a huge long line or standing too close together. So they're going to help with the logistics on receiving people, and that's a good first step that gives you an indication the kind of thing the military can do. Now, of course, they can also do things like build full-up field hospitals if they need to. They can help to enforce quarantine laws to check why people are out and to help prevent the spread, to do things like road checks where you'd have to explain where you're going, something we've seen police doing here on the bridge between Ottawa and Gatineau to enforce that province's no travel rules that they have. So there's a lot of things the military could do, but this gives you sort of that first taste. All of the provinces so far have felt they have this under control, so they've not asked for the help of the Canadian Armed Forces to come in and support them. But this will be sort of that initial, very small-scale deployment in just helping to make sure that there's organization in how people are being received, that they are standing at an appropriate distance apart, and perhaps with their processing as well, but not with the actual medical treatment in any way.
Okay, Mercedes, let's talk about the official death toll in China. There are questions about that.
Yeah, Robin, so last week, actually technically still this week, it's Saturday, it all blends together when you haven't left your condo in 12 days. 14 days, see, there you go. But basically this was an intelligence report that came from American intelligence saying that China had not disclosed the extent and the severity of coronavirus, that it had essentially hidden some of the numbers. They'd not been properly reported. And that actually led Chinese authorities to publicly reprimand health authorities in China, and which is a bit of a show potentially, but saying, you need to release these numbers, they need to be accurate. And there's questions about whether if they had seen more accurate numbers at the WHO, and if the rest of the world had seen accurate numbers, would it have changed the response in any way in terms of preparing? Prime Minister Trudeau was asked about that and whether Canada has similar intelligence that would indicate that China was not disclosing the full extent and severity of the disease. He kind of talked around it, Robin. He didn't say that we did or did not have that intelligence, but we certainly have indications at Global News from intelligence sources the Canadian government did have similar intelligence and did not believe that the Chinese were fully disclosing their numbers. What the Prime Minister said is right now they're basically focusing on the crisis that's in front of them in Canada, and later they will be looking at countries that maybe were not as forthcoming as they should have been globally. The Health Minister, Patty Hajdu, was questioned about this. Her response made some headlines because she essentially said that they trust the numbers coming out of China and that the WHO was the one who had verified those numbers. They trust the World Health Organization, and discouraged people from asking questions about it because she said that it fed into conspiracy theories. But at the end of the day, there will be questions when all of this is over about how much people knew and when they knew it, not in a conspiracy sense, but in a sense of did we act knowing what the full numbers were, would it have changed public policy? And it's possible that it wouldn't have changed it at all. We don't know at this point. But that initial questioning that is now starting to not just be people asking questions, but actual intelligence agencies saying the disclosure on this may not have been as complete or as full or as upfront as it should have been, are certainly playing in the background.
All right, let's quickly talk about testing. The WHO has been emphatic about this, but there have been shortages of tests. It's not like we have drive-through testing in every part of this country. So is it too late to test at this point?
Well, I wouldn't want to say whether it's too late or not. I don't know that given my background, but I would say that there are countries that are doing a lot of testing, Robin, countries like Germany, South Korea, who have seemed to have dealt with this outbreak fairly successfully. And one of the things that testing does is it allows you to get a full picture of how widespread it is in the population. And it might tell you some information that's useful in terms of coming up with public policy around that testing. We really don't know how many people in Canada have coronavirus. And the reason is there's a fairly high standard to get a test. You have to meet a number of criteria, like you've been out of the country and you're demonstrating a cough and fever. Not just anyone can go and get tested. You can show up at the site, but they will ask you questions. And if you don't meet the benchmark, you won't be tested. The reason for that is because there's not enough tests to just be testing everyone. They have to save it for people who potentially pose a risk to themselves or to others. But that means we don't really have a sense of how widespread it is in the population, of how accurate the models we're seeing are as a result. Even things like the mortality rate can be affected by that. If you look at countries that are doing a lot of testing, they seem to have a lower mortality rate. Now, is that because they, for some reason, have fewer people dying? Or is it because they're comparing the people dying against a much larger population that they are aware has it? We don't know how widespread this is in the Canadian population. That's part of what those physical distancing measures are, because there are people who are watching at home who feel just fine and could be a carrier for the virus.
We're going to interrupt you right now. The Prime Minister is about to speak. Let's listen in.
The last few weeks have been hard in different ways for everyone. You're worried about your job or your business. You're concerned about your health or the health of an elderly parent. No matter what this has meant for you, I know you're looking for answers. Knowing where we are now and where we might be in the coming weeks and months is how we can all figure out our response. For you, that could be planning on how to make sure the kids keep learning even though they're at home. For our government, the numbers and data compiled by our experts are critical to understanding the scope of this pandemic and informing the decisions we make to keep you safe. And we've made sure you can access the most reliable, accurate information available to us at canada.ca/coronavirus. We're going to keep releasing up-to-date data on a daily basis and using it to inform our decisions. And we'll continue working with the provinces and territories on getting new information to have a complete national picture that we'll share with you. Regardless of the varying models or predictions, one thing is consistently clear. The measures that have been put in place by all orders of government, from closing schools to staying home, are saving lives. But this will only keep working if everyone continues to do their part. If everyone takes their duty to nurses and doctors, to the elderly and to the vulnerable, seriously. As seriously as if it were the life of their parent or their child on the line. Because it is. The cashier at the store is someone's brother. The paramedic saving lives is someone's wife. That's what's at stake here. The lives of the people we love, the lives of the people our neighbors love. So do your part. Wash your hands. Stay 2 meters away from each other. And above all, stay home.
Now, for the past few weeks, we've been staying home. This is what we have to do. We have to keep our distance from others, and we have to continue to wash our hands regularly. It's really at home that most of us feel safest at this current time. But just imagine if you were more scared of staying at home than actually going out and confronting this pandemic. Unfortunately, that's the reality for far too many Canadians. That's the daily lives of those women who are victims of domestic violence. No mother should have to choose between keeping their kids in a house where they're in danger or taking them to a place where they might fall sick. So what we've done is to invest $40 million in women's shelters and centres that help people who are victims of domestic violence. And for Aboriginal women and children fleeing domestic violence, well, we've invested $10 million for them in emergency shelters. Now, this money will help women's shelters to take all the necessary measures to protect people not only against violence but also against COVID-19. To help the homeless, we've increased the budget funding for programs for them by $157 million. Those running their programs will be able to buy new beds or rent new buildings to keep people apart. We're sending money to communities that are in need, from Vancouver to Saskatoon, Halifax to Toronto. It's not just an issue of giving a safe place for people to escape violence or to give them shelter when they don't have a home. It's really an issue of protecting everyone in our society against COVID-19. That includes the most vulnerable among us.
No one should have to choose between being somewhere they're unsafe and risking getting COVID-19. That's why we've invested $40 million for women's shelters and sexual assault centres across the country. And for Indigenous women and children fleeing violence, we're providing $10 million for emergency shelters. For other shelters, we've boosted funding for the Reaching Home program by over $157 million. This will help buy things like physical barriers or rent new space to keep people safe. The communities that need this funding have now been identified, and money is getting to them. For people from Victoria to Hamilton and Regina to St. John's, help has arrived. I know we're asking a lot right now. To stay home, to not see friends, to close your business temporarily. It's not easy. I get that. But these sacrifices are necessary. The price of acting otherwise is just too steep. To those who are sick right now or have family in hospital, in the ICU, to those who've lost a loved one or a friend, we're thinking of you, we're here for you, and you remind us of what's on the line. We all need to take physical distancing very seriously. Done right, these measures will save lives and bridge us, slowly but surely, back to normal. At the same time, we're working around the clock to get Canada the resources we need. In the next 48 hours, we will be receiving a shipment of millions of masks by a chartered cargo flight. We're also working with provinces to transport their medical supplies when possible. Items ordered by Quebec will be on this flight. Our government has also leased a warehouse in China to help collect and distribute these items as quickly as possible. And going forward, the flights we're chartering to get the materials here include Canadian companies Cargojet and Air Canada. I want to take a moment to thank everyone, whether you're working in a warehouse, flying the plane, or part of the ground crew, for your dedication.
Having some technical difficulties with the Prime Minister.
All right, interrupted with you. We apologize.
We can still hear him. Nope, we've lost the Prime Minister. Oh, now he's back. Let's see if we can listen in.
It appears we do have the Prime Minister's
to support you while you do your part. So this weekend, stay at home. Protect your loved ones and our frontline workers. Save lives. I want to take a moment to talk to kids again today. Even at home, there's lots of stuff going on. There's lots of stuff to do. I'll be holding a video conference tomorrow with Dr. Tam to talk through some of your questions. I know a lot of you have sent them in, and I look forward to seeing you tomorrow. Tomorrow, you'll also have a chance to ask someone who knows better than anyone else about staying inside, an astronaut. Canadian astronaut Jeremy Hansen will be live on YouTube tomorrow to talk with you. So ask your parents to help send in a question ahead of time. Aux enfants, je sais que vous avez beaucoup de questions.
For kids, I know you have many questions. Tomorrow, you can tune into my video conference with Dr. Tam. Well, I'll be answering all your questions. And please don't forget that the Canadian astronaut Jeremy Hansen will be on YouTube tomorrow to answer your questions as well. Now, to protect your wages and the economy, we have developed a three-step plan, which will help us to protect jobs, to support small businesses, and to help those who have lost their income, to protect your health and the health of all our essential workers. We're working with several businesses to manufacture and distribute medical supplies and also PPEs as well. We will be helping you. We'll help you to get through this storm. We need you to do your share as well. We need you to step up to the plate. I know I can count on you. This weekend, stay at home, please. Please save our frontline workers, save lives. Thank you very much.
Thank you, Prime Minister. We'll now take some questions from the phone. As a reminder, one question, one follow-up. Over to you, operator.
Thank you. Merci. The first question is from Teresa Wright from the Canadian Press. Your line is open. Votre ligne est ouverte.
Good morning, Prime Minister. Yesterday, in response to questions about the White House order for the U.S. to stop exporting N95 masks, you mentioned the thousands of nurses in Windsor that go across the bridge to Detroit every day. Is Canada considering stopping those nurses from going to the U.S. as a retaliatory measure?
No, we recognize that our countries are deeply interlinked in sometimes very complex ways. The necessary goods and services that flow back and forth across our border keep us both safe and help us on both sides of the border. We are continuing to engage in constructive discussions with different levels within the administration to highlight that the U.S. will be hurting itself as much as Canada will be hurting if we see an interruption of essential goods and services flow back and forth across the border. We continue to demonstrate that this is a good thing for both of our countries, and we look to continue to ensure that essential supplies get across the border.
How concerned are you that those arguments, that case that you're trying to make, could be falling on deaf ears?
We've had extremely constructive conversations with the Americans over the past weeks throughout this crisis, and we continue to get very good response from them on this issue as well.
Thank you, Teresa. Next question, operator.
Thank you. Merci. The next question is from Rod Nickel from Reuters News. Your line is open. Votre parole est à vous.
Prime Minister, Premier Kenney said yesterday that his government will take part in next week's OPEC Plus conference call. Will your government participate in that conference call whenever it happens? And what specific outcome in terms of global supply cuts is your government looking for?
As you know, that conference call, that meeting for Monday has been cancelled. We're continuing to engage with our partners and look very carefully at how we can ensure that Canada's perspective and Canada's voice is heard during these important deliberations.
And just as a follow-up, to what extent is your government holding off on finalizing its oil support package pending these global talks about supply cuts?
No, we are continuing to work forward regardless of what happens in the global context on support for oil and gas workers who are suffering. But that is why, at the same time, we move forward early on in direct support for workers across the country in all industries. The wage subsidy and the CERB will be there to support Canadians who've fallen onto difficult times because of COVID-19.
Well, we recognize that we have to make sure we help workers and industries that have been hard hit, like the oil industry, for example. And we will continue to look at how we can do that, and quickly, promptly. But at the same time, I'd like to point out that the measures we've already taken, be it the wage subsidy or be it the Canadian Emergency Response Benefit, that'll help people in all industries across Canada who are facing a tough time because of COVID-19.
Next question, operator.
Thank you. Merci. The next question is from Catherine Lévesque, La Presse Canadienne. Your line is open. La parole est à vous.
Yes, hello, Mr. Trudeau. I'd like to get back to what you were saying previously on the masks that are coming in. I was wondering about the masks from the 3M company. Could you check if they're going to come in? Those masks will be coming from China, and we are working to make sure that the lines of supply are still functioning and that those masks be arriving and that they be those. And just to get back to Mr. Trump, did you telephone, or are you planning to telephone and speak to Mr. Trump? And is there anything else to do? Could we use NAFTA or any other means in order to settle this issue? Since the beginning of the crisis, I have spoken on several occasions to the President, and I intend to speak to him again shortly. At this time, conversations are happening at different levels to stress to what extent essential goods and services flow in both directions from our borders, whether it be doctors or nurses who are working on the other side of the border, or whether it be goods or services and medical equipment such as masks or gloves that are coming in, or test kits that we are sending to the U.S. Our economies are so intertwined that it would be hurtful to both countries to have any kind of blockage in the chain of supply chain.
Speaking to President Trump in the coming days. I have spoken with him a number of times over the past week since the virus really started to hit hard. We're continuing to engage at all levels with the administration, having very constructive conversations, highlighting that the flow of goods and services that are essential to both of our countries flow both ways across the borders, from medical professionals right across the country who live in Canada and work in the United States, to essential goods from gloves to testing kits that Canada ships to the United States. It is in both of our interests to maintain this extraordinary close relationship.
Thank you, and we'll take one more question on the phone, operator.
Thank you. Merci. We have a question from Michel Lamarche, TVA. Your line is now open. La parole est à vous.
Hello, Mr. Trudeau. I'd like to know if you have broached with the Americans the fact that paper pulp that is used in order to make N95 masks actually comes largely from Canada and from Nanaimo, namely. We could stop the flow and the export of paper pulp. Have you thought about this? Yes. We have stressed this. We have stressed at many levels all of the goods and services and essential resources that go to the other side of the border. We do not want to start limiting our exports to the U.S., either in goods or services. Our country is in a far better situation, but we need to be able to count on each other. And I am certain that we are going to be able to find a solution to this conundrum.
In many different ways, the very many different products and resources that flow across the border in both directions to ensure success for our economies, success in keeping our citizens safe. We are not looking at retaliatory measures or measures that are punitive. We know that it is in both of our interests to continue to work collaboratively and cooperatively to keep our citizens safe, and that's very much much the tenor of our conversations, and I'm confident that we're going to get there.
Mr. Trudeau, we now know the various scenarios that have been presented for Ontario. You heard them yesterday. I'd like to know what reaction you had to this, and does this resemble in any way the kind of scenarios that are going to be presented for the whole of Canada, and when will you be revealing yours? Yes, we saw the Ontario scenarios. We are waiting for the Quebec scenarios to be presented. We are presently working with the various provinces to get the correct data and the correct information in order to be able to forecast various scenarios to Canadian and to answer the questions that everybody has. How serious can this become? How can we reduce, or when will we be able to reduce isolation methods? But every scenario, every forecast model that we are going to come up with is going to nevertheless be based on one fact, that we need to stay at home. We need to limit our movements. We need to keep 2 meters distance, 6 feet distance from each other. It is our collective behaviors as Canadians that is going to mean that whatever model is created, whatever scenario is presented, that that is how we're going to get the least amount of possible damage, the least amount of deaths. Like I said, we will be showing you some models in the days to come, but every day we are letting Canadians know what the real figures are, that we are getting from all of the various provinces.
Want to know how bad this is going to get, how much longer it's going to last. We saw modeling and predictions from Ontario yesterday. We know we're getting more modeling and predictions from Quebec in the coming days. Canada, at the federal level, will continue to pull together the information and make models and predictions based on that. But regardless of the curves and the models put forward, one thing is consistent throughout all those predictions, that the more people stay self-isolated, stay at home, keep that 2 meters of distance from each other, don't go out unless absolutely necessary, and wash their hands regularly, the better off we'll be. We will be continuing to share up-to-the-minute data on canada.ca/coronavirus. Please go check it out, see all the public data, the data that we're making public from all across the provinces, and we will continue to build and share our predictions in the coming days on how Canada is going to be doing as a whole.
Hi, Prime Minister. Mackenzie Gray with CTV. Kind of following up on the previous question, yesterday when the Ontario government put out their projections, they said that between 3,000 and 15,000 Ontarians potentially could die from COVID-19, that we could be in this from 18 to 2 years, and that potentially could be 3 waves of this. You've seen the projections that Dr. Tam and Public Health have put forward. Are the models that Ontario put forward consistent with what you've seen so far?
From the very beginning, we've seen a range of models talking about the coming weeks and months to much longer than that, talking about very high numbers of possible deaths to talking about very low numbers of possible deaths. We know the situation is serious. We know there are a range of possibilities, and every given model will just give those range of possibilities. What actually happens depends on the choices and the actions that we take every single day. That's why, regardless of the model that is put out there, we can impact that model. We can change the predictions based on how we act. Staying home, keeping 2 meters distant, washing your hands.
Dr. Donnelly referenced yesterday that Ontario was able to make predictions on the mortality rate largely because we're able to look at international data that we've been able to collect so far on mortality rate. If that's the case and Ontario's been able to put out projection, other provinces are going to do so, why can the federal government not confidently put out a number right now?
Well, we recognize that different countries around the world face very different mortality rates, very different situations depending on their local circumstances. The same way in Canada, the way different provinces are experiencing, are handling, are bringing in measures to adjust to their situations vary as well. And at the federal level, we depend on collating, collecting, and aligning all that data from the provinces in order to build a better picture of what's going to happen across the country. We've seen different provinces put out numbers, put out data, put out models, but before we can get to a proper national model, we need to have an even better idea of what we're doing in various provinces.
We acknowledge that various provinces have various circumstances to deal with, as is the case with many countries around the world, and they will have to deal differently with what they have to deal with. And at the federal level, we are collating all of the different data to be able to understand what Canada is facing globally speaking. We depend on the forecasting and the data that is given to us by the provinces, and that's what we're presently doing. And we're getting all of that data, we're verifying, we're aligning them in order to be able to share them with you all in the next few days and to understand what we can expect.
President Trump made it very clear that he's unmoved by your urgings and that he will go ahead with this ban on exports. So what is the number, what is the impact that this has on Canada's medical supplies?
As we've said, we have been working day and night to source medical supplies for Canadian frontline workers. We have shipments coming in the next 24 hours. We've received shipments over the past days. We continue to work with suppliers around the world to ensure that we do get the medical equipment that we need, and we have more coming in regularly. At the same time, we're working with the American administration to ensure that they understand that goods and services that are essential to both our countries flow in both directions across the border, and it is not in any of our interests to actually limit that flow. We are also, of course, turning towards Canadian manufacturers as the tremendous effort that Canadian companies are putting in to develop made in Canada products, PPE, equipment, and medical supplies that is going to actually not just supply Canada, but be there to supply other countries who need them as we meet our own needs. This is part of what Canada is doing to ensure that we are protecting our frontline workers and all Canadians every single day.
We will continue to work and do everything we can to bring these essential products to Canada. We are going to continue to work with the American administration to stress to them how important it is for both of our countries to have goods and services that are essential on both sides of the border, and we will continue to work closely with industry and the manufacturing sector in Canada to develop made in Canada solutions to keep our health workers and our people's safety.
You don't have the numbers, or does it mean you're not willing to share it? And given that the EU has also done this several weeks ago now, why isn't Canada doing the same?
We understand that it is really important to keep global supply chains flowing. We know that Canadian frontline workers are depending on the arrival of PPE from around the world, and that's why we are facilitating those arrivals. They've arrived last week. We've got more coming in the coming days. We will continue to work to ensure that that comes in. We're also continuing to impress upon countries around the world that they are hurting themselves when they limit the flow of essential goods across their borders. We need to work together to make it through this global pandemic. That is what Canada will always do.
Brian Mullen, Global News. A question about testing. Why didn't Canada start procuring tests earlier when we saw what was happening in China? Are you concerned with the limited amount of testing means that you don't have an accurate picture of what's going on to inform policy, especially the potential role of asymptomatic people silently infecting other Canadians, which more testing would have identified?
Canada has been doing an awful lot of testing. We have been ramping up testing. We've certainly done more testing than a lot of other countries like the United States. And we've seen that early and strong strong testing in places like Alberta and BC have been very, very effective at managing and controlling the spread of COVID-19. We recognize that mass testing and accurate rapid results are a key part of managing the virus going forward, of ensuring that we continue to be safe through the coming months, and that's why we are increasing our testing capacity every single day.
We acknowledge that testing is an essential part of the management of the spread of the virus. Generally speaking, we have done quite well when it comes to testing and screening, but we can do more, and this is why we are continually increasing our testing capacity. We have noticed that in Alberta and in BC, for instance, widespread screening has been extremely efficient as a tool in order to be able to stop the spread or slow the spread of the virus. We know that we need to do more around the country, and this is why every day we are increasing this capacity.
Are you concerned that the battle we're seeing over face masks, such as the one we're seeing now with 3M, could extend to other medical supplies and medications to treat COVID-19? Could this just be the tip of the iceberg, and what are you planning to do about it?
That is one of the reasons why we have turned towards Canada's local industrial capacity to develop these solutions for the coming weeks. We know that Made in Canada solutions are on their way because thousands of businesses, of manufacturers across this country are stepping up, are switching their assembly lines and supply lines over towards producing the necessary medical supplies and equipment that we need. In the meantime, we will continue to source these products from suppliers around the world. Shipments are coming in over the next 48 hours. We've had shipments come in over the past few days. We're going to continue to do everything we can to ensure that our frontline workers get the support and the protection they need.
But do you have concerns that these shipments could be in jeopardy?
Okay. We know that there is a global competition for these products. Every country in the world needs more of them. That's why Canada is shifting over so much of its industrial production to develop these masks, these solutions, these equipment, so that we can cover our own needs over the medium and long term, and be there to help other countries at a point where we have enough for ourselves as we manage the spread of COVID-19. At the same time, in the short term, we're continuing to procure the necessary equipment that our women and men on the front lines need right now.
Well, we recognize that there is global competition, strong, ferocious global competition for this equipment and these supplies that everyone's trying to buy. That's why we're developing our domestic capacity to manufacture the essential supplies that we need to protect our frontline workers here at home. Now, this is a solution which will be a medium-term solution, but in the short term, we're still receiving goods from across the world because these supplies are essential to keep people safe. Christian Noël, Radio Canada. You've talked to Mr. Trump about NAFTA and masks. On NAFTA, do you think it's perhaps worth waiting before we actually implement it, as others, as some people are calling for? Do you think that's something that should perhaps be delayed until later? Now, on masks, what will you be saying to him? What's your strongest negotiating chip here? Well, on NAFTA, we understand that the regulation harmonization process will take some work. There are people within government who are already working on that. They've got a lot of work on their plate in terms of our response to COVID-19. But I'd like to tell people that the new NAFTA will be implemented very, very soon. It might take a bit more time, but it will be implemented. The current NAFTA remains in force, however, and guarantees free trade with the U.S. So we will be working in coordination with Mexico and the U.S., but our priority at this current juncture is to continue to take all steps to protect Canadians and to deal with COVID-19. Now, in terms of my conversation with President Trump, well, I've I'm going to be pointing out that there are Canadian healthcare workers who cross the border on a daily basis to work in the U.S., and the U.S. depends on them in many cases. We have many goods also which we export to the U.S. It's essential for them in their fight against COVID-19 as well. I know that the conversation will be very constructive, as they always are.
We will continue to work very, very hard to remind the Americans, as I will in my conversation with President Trump when it happens in the coming days, that we are, both of us, interlinked in ways that means that it would hurt both of our countries in our ability to protect our citizens were supply chains to be disrupted. There are Canadian health professionals right along the border with the United States who engage in supporting American medical systems in a daily basis, and that would be something that is valuable to the United States. It's also extremely valuable that we are part of essential supply chains for things from testing kits to gloves to the ingredients in N95 masks. We know that we do better when we work together, and that'll be my message to the President. On va travailler avec les Américains et les Mexicains pour...
We'll be working with Mexicans and the Americans to implement NAFTA, but it's something that we'll continue to work on. But now our priority has to be COVID-19.
In the United States on the ratification of the new NAFTA, but as a reminder for everyone, the existing NAFTA is still very much in place and will remain in place until such a time as the new one is brought in. The people who are working, who usually work very, very hard on ratification of trade deals, like most people in government, are very much focused on our response to COVID-19, and that needs to be our priority right now. Merci beaucoup tout le monde. Merci tout le monde.
You just heard the Prime Minister in his daily address providing more details on the federal government's response to the COVID-19 crisis. Let's go to our Ottawa Bureau Chief Mercedes Stephenson, who's working from home. Mercedes, let's talk about the battle over the 3M masks. The Prime Minister was quite restrained with his response to the questions, but there's obviously some tension between the Trump administration and the Trudeau government.
Yeah, so what happened here was that, for those who are just catching up, the president told 3M to stop shipping medical masks overseas to other countries, including Canada. 3M said, we're not going to do that. There would be terrible humanitarian consequences, not to mention the possibility of other countries retaliating. And the Prime Minister was asked yesterday whether Canada might retaliate. And people had speculated he seemed like he might be hinting at that because he'd said, look, we're very reliant on each other. It's not a good idea for either country to start cutting off goods that cross the border because it will hurt the other one. And what hurts the other one hurts us too. There are many, many nurses that leave Windsor every day to go to Detroit and work in hospitals to help patients who are diagnosed with COVID-19. And people went, well, was that kind of maybe a subtle, veiled threat at retaliation? Today, he was very explicit in saying, we're not looking at retaliation. They're still talking to the United States government. Donald Trump last night said he was not happy with 3M. They could push back as much as they wanted. This was the way it was going to be. But then late last night, the White House sent a statement to CTV News saying that this would not apply to countries where there is a direct U.S. national interest in allowing the masks to go. And that has been the argument that Chrystia Freeland has been making, and that I expect the Prime Minister is likely going to make too, that it's in U.S. national interests to make sure that the Canadian system is stable, that healthcare here is good, that we're able to continue to provide them with things like pulp to make those paper masks or nurses to work in their healthcare system. So I think they're still working that out. He's trying not to inflame Donald Trump, would be my guess. That tends to not be a good move, while still standing up for Canadians. So we'll see exactly what happens with this going forward, Robin. But at this point, 3M did tell Canada yesterday, in fact, the procurement minister talked to the CEO of 3M, that no masks have been delayed or diverted at this point or canceled for Canadian shipments.
Okay, Mercedes, stay with us. We're going to bring in our chief political correspondent, David Aiken. David, what did you make of all this talk with the 3M masks?
Well, I think among other things is the Prime Minister did say right at the beginning that 1 million masks are en route right now to Canada in the next 48 hours. And unfortunately, I mean, it's a limited press conference. He did not describe what kind of masks are en route. Are they N95 equivalents? Are they surgical masks? And where are they coming from? We would have liked to have heard more information on that, I think. He also said that as Canada attempts to get this supply chain system set up globally, that Canada, the federal government, has leased a warehouse in China in which they will collect equipment being manufactured in China to be shipped here in Canada. I think that's important because over the last 24 hours, we have heard that the United States has somehow hijacked a shipment of N95 respirators bound for Germany that were in Thailand. So here's a shipment in Thailand going to Germany, and the U.S. has somehow intercepted that shipment. So Canada taking steps now to lease its own warehouse and presumably provide its own security for any gear it gets from China. And again, the Prime Minister saying Air Canada and Cargojet have been contracted to make sure that gear gets here. But again, we'll certainly be following up, and we'll have these reports later on our website about 1 million masks are en route from somewhere to Canada in the next 48 hours, but we don't know what kind of masks those are, and that's an important detail to figure out.
And yesterday we know that Ontario released its projections, and they're very worrisome. But again, he seems to be avoiding that question. What do you make of that, Mercedes?
Well, I think, Robin, that there's a lot of questions we're still trying to get to the bottom of. And we have this press conference every day, which is great because it's not often that we get to ask the Prime Minister so many questions every day. But one of the sort of challenges and frustrations has been that we don't necessarily get an answer to those questions. That's not unusual with politicians, but I get a lot of viewer mail about that. So we certainly are trying to press and to ask questions. And sometimes I think they're still working through their answers. It's really an evolving situation that's going very quickly. Today he was asked about the masks. He was also asked about testing and whether there is enough of that and whether we have an accurate picture. He was asked about the modeling, and he won't really say why they won't release the federal models. And he's talked about the provinces having to release theirs first, and each province does it differently. That's something I've heard from sources behind the scenes too, but those same sources say public health has a sense of modeling. You look at other countries and you have a sense of projections, and they've been very reluctant to release those projections. Now they are going to do so eventually. We still don't know what day. It sounds like it's getting closer. We still don't have an answer on ultimately whether they are going to change their guidance on masks. So far they've been saying, you can wear them if you want, but don't wear a surgical mask or an N95 mask because those are really needed for people on the front lines. If you want to wear a mask, you can make one at home with a simple pattern, cut it out, and choose to wear it. But that's a personal choice. So we're still really kind of digging around trying to get information on so many subjects, Robin. And I think sometimes that's because the answers are still evolving as we go.
David, he was asked about
Robin,
testing. Yeah, go ahead.
Sorry, Robin, I just want to chip in and just amplify what Mercedes says just on this data. The Prime Minister today was actually quite direct, and he's hinted at it in previous days on why not a federal model and kind of throwing it back at the provinces. Ontario has good numbers, BC has good data, Quebec presumably has good data, but the ability of provincial health authorities very significantly provide accurate data. And that was the Prime Minister said, before we can put out any federal numbers, we need better provincial numbers. So again, kind of throwing it back at provincial capitals to get some of this data together.
David, I was going to ask you about the testing question. He was asked, should they have started it earlier? What was his response to that?
Right, and I guess he sort of says we're doing a lot of tests. I mean, that was, as Mercedes said, the classic politician response, sort of saying, oh, we're doing a fine job. We know that testing ramped up quickly in BC. Again, it's provincial authorities really who have a lot of the responsibility here, and that's the way our system is set up. Ontario got on board, and Quebec is kind of getting on board. But certainly South Korea is the big example where there was absolutely mass testing, and South Korea's curve has remained flat, and a lot of people chalk that up to testing. So a legitimate question, but perhaps also here, this is a problem of our federation. It is not up to the federal government to initiate testing programs. It's up to provincial health authorities to do that sort of work.
And finally, Mercedes, let's talk about the fact that different levels of government are talking on the American side and the Canadian side. Trudeau seemed to indicate that the dialogue is still open, right?
Oh, yeah, the dialogue is definitely still open, Robin. They're still talking. This hasn't closed. The decision hasn't been made. They have to talk every single day to try to manage this relationship because neither country can afford for it not to be managed. But there are still some key questions, and it's not just the masks. It's also about keeping essential workers able to cross the border. But some people want that tightened, Robin. They think there's still too many people designated as essential and that it risks spreading coronavirus.
All right. Thanks for that, Mercedes. Let's recap what we heard from the Prime Minister today. today, he spoke about modeling scenarios, saying his government is waiting on more data before releasing forecast models to Canadians. But he reiterated our actions can change any projections. He confirmed millions of masks will be arriving on a cargo flight within the next 48 hours, and arrangements are being made to import other much-needed medical equipment. Ottawa continues to be in discussions with the Trump administration about any disruption to shipments of essential items, especially those N95 respirator masks and other medical supplies. But the Prime Minister says he's not considering any retaliatory measures. And finally, the Prime Minister reminded everyone it's the lives of your loved ones at stake, the lives of the people your neighbors love. It's the lives of the people who are still on the job. From hospital workers to grocery store clerks, those are the lives at stake. So it's all up to us to do our part by staying home, washing your hands, and taking steps to prevent the spread of the virus, even if you don't have it. And you can find full details on globalnews.ca and tonight on Global National. I'm Robin Gill. Thank you for watching. We now return you to regularly scheduled programming.
This has been a special report from Global News.
be community spread in our area,
et que le respect de la
and
distance
keeping
de
to
2
our
mètres
2-meter
est
distance
l'option la plus
is the
sûre.
safest
Nous
option.
continuons de procéder rapidement
We
et un
continue
très
to
grand
test
nombre
at a
de
high
tests de
rate in
dépistage au
Canada,
Canada, puisque plus de
tests
309 000
completed for
personnes
over
ont déjà subi un test.
309,000 people in
Environ
Canada.
4% de ces
Around
personnes ont
4%
reçu
of these
un
people
résultat
have been
positif
confirmed as
et
positive,
95%
and
ont reçu
95%
un résultat
confirmed
négatif.
as negative.
Chaque jour, nous
Every
travaillons
day,
avec les provinces
we
et
are
les
working with
territoires
provinces and
pour
territories
accroître la
to
capacité
increase
des
laboratory
laboratoires
capacity
afin de maintenir
to make sure
ce
we
degré de
maintain this level
précision
of
dans le suivi
sensitivity
de
in
l'activité de la
tracking
COVID-19.
COVID-19
L'Agence de
activity.
la santé publique du Canada
Today,
a
the
publié
Public Health
aujourd'hui
Agency of
le tableau
Canada
de bord
released the COVID-19
de la
situational
COVID-19
dashboard
pour le Canada.
for Canada.
Ce tableau de bord vise
This
à rendre
dashboard
les
aims
données
to make the
dont
data
nous
we
disposons
have
plus
more
accessibles
accessible,
afin que les
so
Canadiens
Canadians
puissent
can
rapidement en
quickly learn
savoir
more
plus sur
about how the
l'évolution de
outbreak is
l'épidémie et
evolving
trouver des renseignements
and search
précis.
for specific
C'est la première
information.
fois que des données
This is
canadiennes
the first time
faisant autorité
authoritative
sont
Canadian
intégrées
data
dans un
has been
tableau de bord
integrated into
interactif
an
et
interactive
personnalisé.
and customized
On sait qu'on
dashboard.
parle au nom des médecins hygiénistes en
I know I
chef de
speak
tous
for
les
chief
pays, de
medical
tout le
officers
pays,
across the
et
country
en affirmant que
when
nous
I
sommes
say that
reconnaissants
we are
pour les
grateful for the
efforts de
efforts
tous les
of all
travailleurs de la
those
santé
who work
publique,
in
des
public
soins de
health,
santé et des
healthcare,
laboratoires qui
and
font en sorte
laboratories
de trouver
to
les
find
cas,
cases,
de retracer les
trace
contacts et
contacts,
d'interrompre la
and interrupt
transmission pour
transmission
ralentir la
to slow the
propagation
spread
de la
of
COVID-19.
COVID-19.
Nous remercions également les
Likewise,
Canadiens de
our
contribuer
thanks go out to
en changeant
Canadians
leur
who are doing
comportement,
their
en
part by
pratiquant
changing
l'éloignement
behaviors, observing physical
physique
distancing,
et en renonçant à leur plan
and
pour
disrupting
relever
plans
ce
to
défi
take on this
national
national
d'aplatir
challenge
la courbe.
to plank the
Nous
curve.
devons maintenir notre élan
We must
en
keep this
attendant les
momentum
signaux
as we
qui nous
wait for the signals
indiqueront
that will
que nos
tell us
efforts
our
portent
efforts
leurs fruits.
are working.
La seule façon de s'en
The only way
sortir
to get through
est de le
this
faire ensemble.
is together.
Canada, faisons
Canada,
tout ce qui est
let's
en
do
notre
all we
pouvoir
can
pour
to stop
arrêter
the
la
spread of
propagation de la
COVID-19
COVID-19 dès maintenant.
right now.
Merci.
Thank you.
We'll now start the question period. Nous commençons maintenant la période de questions. Pour les questions dans la salle, s'il vous plaît, utilisez le microphone sur le plancher. For questions in the room, please use the floor mic. We'll start on the phone. Operator.
Nous allons commencer par téléphone.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while the participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you very much for your patience. Merci de patienter. The first question is from Teresa Wright from the Canadian Press. Please go ahead.
Allez-y.
Good morning, Dr. Tam. I'm wondering when you talked about ramping up testing across in the different provinces. I'm wondering what kind of capacity we have to continue to ramp up the number of tests that are being done in terms of personnel trained to do this kind of work.
Administrer. A-t-on le personnel nécessaire pour le faire?
I think in the Canadian context, there's already a pre-existing network of public health laboratory, hospital labs, and others. So the way that we are looking at ramping up laboratory testing, there are many different streams. First of all, the current test that we're doing is a PCR test that detects the RNA, the genetic component of the virus itself. And what we're trying to do is to set up and support different provinces to set up more what we call high throughput testing, so that you can do more samples faster, and different jurisdictions are actually doing that as well. And so, and secondly, looking at what we call rapid tests that can be done not in high volume, but is very useful if you were living in more remote areas where transportation to the nearest lab is more difficult. So those are undergoing evaluation right now. And those tests can be easily trained, and different clinics or even in the territories, they're used to some of these technologies already, and they will be easy to use. And so training would not be difficult from that respect. Of course, we're always looking at new ways of doing things, aware of that internationally there are different lab alternatives that are coming up, but these need need to be evaluated before we can sort of implement them. But another aspect, of course, which we will look at and is evaluating is, in the end, looking at the antibodies in people's blood and looking at immunity. So all of this is actually ongoing. And I think, you know, as I've said in the last couple of days, Canada is one of the sort of highest per capita testing countries in the world. But we do need to look at an understanding on who we're testing, and making sure we're targeting the test to the populations at the right people at the right time as well. So that needs to be fine-tuned, I think, over time, depending on the epidemiology on the ground. So it is a slightly complex situation, but we're doing everything we can to up our capacity.
Thank you. One follow-up.
And just yesterday, on the projections that were released by Ontario, there were some fairly stark projections when looking at the number of the potential deaths in that province. How consistent are those numbers with projections that you have seen nationally?
So, first of all, I think for sure, I would like people to focus on what is actually happening to the outbreak right now. And I've just said that, you know, we have this dashboard that describes the actual epidemiology, and we need to further understand the details of that epidemiology in Canada right now. So then the use of modeling or other projections, they always describe a range of possibilities. And these possibilities are for planning purposes. They're not actual crystal balls or real numbers. These, depending on the model, they're mathematical functions, etc. And you can sort of flexibly change those parameters. And so we use them as flexible tools. And so different jurisdictions can have different parameters as well. But we do work collaboratively together with all the modelers across the country to look at those range of possibilities. But the bottom line, though, is that these possibilities are highly sensitive to our actions. So as we've said, any actions that we take now changes those range of possibilities considerably. It is important for provinces to input their situation because of these actions that are happening right now. And the experience are a bit different in different jurisdictions depending on the epidemiology. So really just to reiterate that any range of those modeling and projections are highly sensitive to actions, and that's why we keep saying we need to act now and practice social distancing, self-isolation, hand hygiene, and all those measures, because the fate of those possibilities or scenarios are in our hands.
Thank you, Doctor. Operator, prochaine question.
Thank you, merci. La question suivante est de Mélanie Marquis.
Mélanie Marquis.
La Presse.
Question.
À vous la parole.
From La Presse. You have the floor.
Dr. Tam, I was listening to you, and it begs the question: do you think it's a good idea to release these projections, these numbers? Are you comfortable with the idea?
Est-ce que vous êtes à l'aise avec cela?
That's an extremely good question. I think we all want to bring Canadians along to an understanding of how we're planning for different scenarios. But I think that it is our responsibility to ensure that the public actually understands what models are for and what they're about. And so I think with any of us who are looking at releasing some of these projections in the coming days, it is very important for us to explain these as well as we can, so that people do not think that this is what's going to happen tomorrow. These are not the crystal balls. These are scenarios for looking forward to planning purposes, and they need to be adjusted according to some of the real-time information that we have. So I think it's a responsibility that I think we need to all take very seriously, those of us who are releasing that kind of data.
tous au sérieux, ceux qui sont chargés de publier ces
So just to follow up, is that
Question
more
suivie.
a yes or a no? And
donc un oui
as a
ou un
real
non.
follow-up, though, with regard to the U.S. Putting a stop to exporting masks,
les États-Unis qui
3M masks,
interrompre l'exportation
how big
de
does
masques de
an
l'entreprise
impact does it
3M.
have on our supply? To your knowledge,
Quels effets
I don't know,
ont ces
were we
décisions
counting on
sur notre chaîne
50% of these
d'approvisionnement?
masks, these shipments coming from the U.S.? Is it 50%, 60%,
Quelle proportion
10%?
de
Can you
nos
just
masques
give me a
proviennent des
ballpark
États-Unis? C'est
figure?
10, 15, 20%? Donnez-moi
Yeah, just to finish off your first question then, scenarios are, that's what they are. And I think it's reasonable to plan on worst case scenarios and look at where they take you. But it's also reasonable to look at what's happening right now and look at the sort of near term for planning purposes as well. So both the longer term and the near term planning for a range of scenarios is a practice that we do, and it is a useful practice. So in terms of the second question, I know that I'm probably not the best person to look at all the moving parts and the logistics, but we can certainly get back to everyone. But I think just to stress that the global supply of personal protective equipment is, you know, there's a lot of stress related to that system. Everybody's looking at PPE. So we're pulling out all stops. I'm sure numbers in every stream of those purchasing or acquisition lines will change every day in a very dynamic manner. So as to what proportion this particular shipment or source, that will, I am absolutely certain, changes in a very dynamic way.
Thank you. One more question on the phone, then we'll go to the room. Une question au téléphone, puis maintenant, nous irons dans la salle. Merci, opérateur.
Merci, thank you. The next question is from Marika Walsh from the Globe and Mail. Your line is now open. Please go ahead.
Vous avez la parole.
Hi, thank you, Dr. Tam. I'm wondering if you can say specifically if what we saw released from Ontario is representative of what the models show across Canada, or if it's an outlier, and if it is an outlier, whether it's an outlier on the low side or the high side.
Est-ce que c'est moins pire qu'ailleurs?
I don't think it's an outlier. It is a range of scenarios. So I think, you know, looking at different attack rates and different impacts, I think is definitely a very reasonable approach. We do input, of course, collectively the range of serious illnesses, for example, and deaths in a real-time basis as well. But those parameters actually change quite a bit with time. So I think all modelers or jurisdictions releasing data right now knows that those parameters will change.
And as a follow-up, on the U.S. ban on exports of medical supplies to Canada, what impact does that have on our already
l'interdiction des États-Unis d'exporter
supplies?
des masques vers le Canada?
I can't answer that specific question in terms of the U.S. piece, because I think that is still being worked out, and I think I will leave that to our ministers. But we are looking at multiple streams of supply, domestic as well as international over time. So that's again, a very much a dynamic situation. But what I would stress is that we have worked with the provinces and territories to look at providing them, it's a collective decision to look at allocation as well, and how we do that in a sort of real-time basis.
Thank you. Let's start in the room. CTV.
Mackenzie Gray, CTV.
Merci, on passe aux
Dr.
questions
Tam,
de la
we've
salle
asked you a
CTV.
number of questions about masks.
On a posé plusieurs questions sur les masques.
Face more, why they might not necessarily be effective if
Vous
they're not
avez
used
dit qu'ils
right.
ne sont
Yesterday,
pas
the
nécessairement
CDC in
efficaces,
the
ils ne sont
US
pas bien
put a voluntary guideline saying that if people
que
are going
les gens
outside grocery
touchent plus
store,
souvent
pharmacy, that they should wear masks. So is Canada changing their guidance so people should wear
leur
masks outside?
visage. Est-ce que le Canada va changer ses
I recall your question a few days ago, and then I think I've answered this question a few times in the ensuing days, and that's how how fast science might be evolving. So, as I've said, that we're still learning about this virus that's only been with us really since January. And we, like the United States, is looking at the latest information and looking at recommendations right now. So, as I've said in the last time I was at this briefing, certainly we'll be looking at the guidance in many different guidance, actually, not just whether people should be wearing masks in public. From the public wearing of masks perspective, our key message is that we need to reserve medical masks for healthcare workers. And we just talked about the fact that some of these personal protective equipment is in sort of scarce supply situation, and we need to prioritize people who are looking after the sick. And then I would say my next strong message is that there are things that do work that we need to continue to do, and that includes the physical distancing, staying home if you're sick, hand hygiene, etc. So then, one of our recommendations for things that people should do is cover your cough. And not spread things to others by practicing cough etiquette. What we are looking at in terms of the new science is whether people who are just before they get sick transmit. So that's a very important piece of science which is coming out right now. And if that's the case, having some covering protects you from, well, really it prevents you from transmitting your droplets to others. So it does act as an additional barrier on top of all the other things that we're recommending. So I think that what we're saying is that if people use coverings that are homemade or otherwise, not the medical masks, then we will provide information on how you would do that.
So I just want to be super clear. The weekend, a lot of people are going to go out and get groceries, go to the pharmacy. If I'm leaving my house after this press conference listening to you, should I fashion some kind of mask? Should I have something on my face to be covered up?
I think depending on the situation as well as whether you can do social distancing. I think that's one thing you can evaluate. For example, if you're in public transit and you cannot easily practice the 2 meters, for example, then having that additional covering, like covering up your cough, I think is a good idea. So it depends on what activity. So if you can maintain that 2-meter distance, then that is what you should do. But I think having an additional covering and a barrier to prevent you from spreading droplets to others, I think that is a reasonable thing to do. But by the way, we are actually reviewing the science right now, so we'll have more recommendations in the coming days.
Thank you, Dr. Ashley, CBC.
Dr. Ashley, that's good. Ashley Burke, CBC News. What essential medical supplies beside N95s does Canada get from the U.S. that are needed for this pandemic?
Est-ce que le Canada obtient des États-Unis?
I'm going to have to get back to you on that. So I know that we have a range of different supplies that includes a whole range of medical equipment and some laboratory supplies. So I think I am not the lead on the logistics and all the supplies, so I think we're going to have to get back to you.
The U.S. is seeing a shortage of drugs used to treat COVID-19. If the U.S., this executive order happens to impact that and medications coming across the border, could that create a shortage here in Canada? And what are your concerns?
Well, I think there's 2 aspects to this. One is that there's currently no proven treatment for COVID-19, but we do have clinical trial sites, and so making sure that those trials are enabled is very important, and getting supplies for that. So it is definitely something that we are working on. But Health Canada actually has is monitoring the supplies of all essential medicines and drugs as well very, very closely. And so if there's any signs that certain medications are important for Canadians, it is impacted, then specific actions will be taken to look at how we can get that supply from the original source or from other sources.
Thank you, Radio-Canada.
Aux fabricants et à d'autres.
De Radio-Canada.
Christian Noël.
La première question, c'est sur l'avion nolisé de la Chine, dont le premier ministre parlait ce matin. Combien de masques, quel type de masques sont en route vers le Canada? Combien ça a coûté? Et vers quelle province ça s'en va? Et quand devrait-on les recevoir? C'est une question facile.
Oui, merci pour la question. Comme Dr. Tam a constaté, moi aussi, nous autres, à notre échelle, on travaille à l'échelle technique avec nos homologues de santé publique. Avec de toutes les provinces et territoires. Concernant les logistiques, ça c'est quelque chose qui était vraiment un enjeu actuel. C'est une situation qui évolue rapidement. Nous autres, on n'est pas vraiment dans les discussions actives maintenant avec les avions, exactement c'est quoi la quantité de la protection, l'équipement de protection individuelle, c'est des autres. On peut toujours répondre plus tard avec les données, mais à l'heure actuelle, on n'a pas des chiffres exacts.
Permettez-moi à ce moment-là de rediriger ma question. À quel point est-ce qu'on a besoin de ces masques?
On a besoin des masques, l'équipement de protection individuelle. Maintenant, c'est un enjeu actuel. On sait que c'est le marché mondial. C'est vraiment, il y a beaucoup de compétition, on peut dire, une concurrence pour obtenir l'équipement essentiel. Et notre gouvernement fédéral, on travaille étroitement avec les provinces et territoires pour, comme on dit, c'est toujours mieux de voir, comme on dit, les commandes, les achats en vrac ou en gros pour le Canada. Et aussi comme une formule pour distribuer aux provinces et territoires. Et on continue vraiment à travailler comme l'équipe Canada.
Follow-up in English, if I may, on the number of ICU beds that we might need. Ontario had a projection of what they have. Do we know right now in Canada how many ICU beds are available? How many ICU beds we could raise the limit to? And is that going to be enough if we hit high peak?
En ajouter et est-ce que ce sera suffisant?
The provinces and territories are most in tune with the exact ICU capacity availability on any given moment. But what I will be able to tell you is that the number of cases, the serious cases that we have is far within the capacity of Canada to cope with the outbreak right now. What you're seeing provinces doing with these projections, etc., are actually to plan for a much worse case scenario. So they are planning for that. They have essentially cancelled elective surgeries, etc., so that there's actually an excess of beds available right now. So in some jurisdictions, they are at about 50% of the ICU capacity, but it is a very dynamic situation that the provinces can address. You know, at the national level, we can only sort of look at in very crude ways the total number of ICU beds in Canada, and then I can look at the numbers who are maybe in ICU, and I know that Canada has a much bigger capacity for ICU beds than the number of cases right now. But that could change, which is why we want Canadians to do everything that we can to reduce that health impact and reduce the impact on our hospitals.
Maybe if we could just add to that, because I think it's hypothetical in terms of the number of ICU beds and even ventilators that we may need. And so I think nothing's cast in stone, and I think what we're trying to say to all Canadians is that you have to do your part, because we're trying to flatten the curve. It's all about not exceeding, as you say, maybe in this case, ICU capacity. So given the transmission and propagation du virus, what we're saying is that, okay, hypothetically, over time, there may be 1,000 people in a given area that might need ICU care and ventilators. There's a difference if those 1,000 people end up in a hospital in the same week as opposed to being spread out over several weeks and months. So that's what we're talking about, flattening the curve, slowing down the transmission of the virus. So that, and, you know, in the worst or best case scenario, those 1,000 people will be spread out and won't exceed the healthcare capacity. So that's what we're looking at, and certainly Dr. Tam and I, myself, are working with our counterparts, and we're looking at how best to increase the capacity so that we do have that surge capacity. The fact that the hospitals across Canada are delaying or stopping elective surgery, pulling in retired physicians, or all sorts of things that we're doing to basically make sure that Canadians do have access to the care they need. Thank you.
Let's go on the phone now. Maintenant, téléphone opérateur.
Thank you, merci. La question suivante est de Catherine Lévesque, La Presse canadienne. Votre ligne est ouverte, la parole est à vous.
La Presse canadienne.
Oui, bonjour. Je veux juste revenir sur ces millions de masques parce qu'évidemment, c'est une annonce assez importante. Vraiment, M. New, vous n'avez aucune idée combien de masques
are you saying that you have no idea how many masks we'll be receiving and how that will be allocated and the kind of masks that we'll be receiving?
Oui, comme j'ai dit, oui, on sait que c'est une situation fluide.
We know that this is a very fluid
tout le monde,
situation.
le gouvernement fédéral, en concert avec les provinces et territoires, tout le monde est sur la même page. On fait nos meilleurs efforts pour obtenir les masques, comme on dit, de calibre médical, vraiment, comme on dit, l'équipement de protection individuelle sur le marché mondial. Mais on sait maintenant, actuellement, c'était vraiment un défi. On sait qu'est-ce qui se passe avec les États-Unis et les autres pays. Et on fait nos meilleurs efforts. Aussi, dans un autre volet, on a déjà dit que on travaille étroitement aussi avec l'industrie au Canada. Parce qu'à un moment donné, et ce n'est pas maintenant, peut-être dans quelques semaines, quelques mois, on va avoir aussi, comme dit, la capacité pour la fabrication des équipements essentiels au Canada. Et pour le moment, l'instant, oui, c'est sûr, c'est une situation fluide et je ne peux pas donner des chiffres exacts.
OK, merci. Donc, j'en comprends avec vos commentaires que
I was going to just repeat in English, saying that, yes, in terms of Dr. Tam, myself, others, we're working obviously very closely with our counterparts in the provinces and territories. As all of you know, the situation with personal protective equipment and 95 masks is a very live situation. It's fluid. The global market is very competitive. We know what other countries are doing. We've heard what's happening in the United States. We're doing our best efforts, and that's not just the federal government. It's working in concert with the provinces and territories to get the necessary equipment we need for our frontline healthcare workers. So that's priority number one. And we're pulling all the stops, as they say. The other part, though, and this is not something that's going to happen today, but hopefully, in several weeks, months, is that we're also ramping up and looking at our domestic capacity. Because down the road, what we hope to do, obviously, is have domestic capacity to manufacture and make the type of essential medical equipment here in Canada, so we don't have to rely on sort of the global market. So that's something that we're looking at in the long term. But for the moment, it's difficult to give you exact numbers because the situation is so dynamic.
Pas vous donner un chiffre précis parce que la situation change tellement.
Follow-up, Catherine?
Donc, on en comprend qu'en attendant d'être autosuffisant
while we're waiting to be self-sufficient in a few weeks or a few months, and given that we can't necessarily depend on the United States, which countries do you think we can request this equipment from? Will we have to rely on China, or are there other countries that will be able to supply the material that we need?
Peut-être que ce n'est pas pour moi de répondre à ce qui se passe actuellement avec les États-Unis. Tout le monde entend ce que le Premier ministre dit, que c'est vraiment un enjeu actuel. C'est pas que le marché est fermé. Le Premier ministre et tous les autres ministres ont continué des conversations, je pense, très productives avec leurs homologues aux États-Unis pour assurer que vraiment la transportation des biens et des services essentiels continue. À traverser notre frontière avec les États-Unis des deux côtés. Pour nous autres ici, à l'échelle technique, mais aussi, je pense aussi à l'échelle politique, on est prêt à, comment dire, parler avec tous les pays du monde. On fait nos meilleurs efforts avec n'importe quel pays. Si potentiellement il y a une source d'équipement médical essentiel pour le Canada.
Thank you. Let's go back in the room, Mackenzie.
Merci. On passe aux questions dans la salle à nouveau.
Maybe either one of you can answer this. You've mentioned, Dr. Tam, specifically about religious holidays and holidays coming up. Easter is a week away.
Fêtes religieuses qui approchent.
saying my mom calls me up and says, Mac, you can come over for dinner. What example and what advice would you give to Canadians right now who would traditionally be gathering in big groups for Easter? Is Easter canceled? Should we be having people over? What's your advice?
So we're advising, and we actually, I did communicate with religious leaders as well to gain their support to help maintain physical distancing while also continuing the connections that you need, social connections. So we are encouraging people to connect in a more virtual way. I think that's one of the key aspects. But our recommendation is no non-essential gatherings, and most provinces have very key recommendations on gatherings, and anything less than 5 to 15. But again, even a small gathering is a matter of maintaining that social distance and the sort of hygienic practices.
I can just add a personal sort of note. Yes, we are planning for Easter in my family. My 2 boys are in Montreal, in Quebec, and we also have family on the other side of the river. So we're planning a virtual Easter. I can tell you that right now. We're going to try and figure out the timing. We're going to set up our little sort of webcam or whatever, and then we're going to toast each other and celebrate virtually. So that's my personal situation.
Dr. Tam, on testing, I just want to clarify something that journalists have asked a number of times. I went on the Ottawa Public Health website and I took a look at the people who are qualified to be able to get a test right now if you're showing symptoms. One group that's missing is people who are non-essential workers who've not traveled but are showing symptoms. Previously, when we've asked these questions about why people who are showing symptoms but don't have the previous history of travel, the response you've basically given us is that the priority is on the travelers. It's been about 2 weeks now since Canada's closed its borders. The number of travelers coming back is very limited. Are you considering changing the guidelines to expand testing to allow people who don't have a travel history, aren't essential workers, but are showing symptoms to be tested?
So the key recommendation for people with mild symptoms is to stay home, and you can also use some of the apps that are on different websites, certainly on coronavirus.ca, where you can self-assess to determine if you should seek further attention from public health or from medical advice. So hopefully that will help people decide whether they need to present or not for further testing. So the question is an important one in that if you looked at the sensitivity rate of our lab testing, over 95% of the tests that we run are on people who don't have the virus. So we are testing a lot of people who actually don't have the virus, and I think that's actually very reasonable for communities that are trying to detect if they have community transmission or not. And so, and that can be also done in different ways in terms of a surveillance system. But I still think that if your objective is to detect if the virus is in your community and if there's any community transmission, it is still really important to test the people who are severely ill, hospitalized, and then the people who, like health workers and those very specific situations. What we're asking all Canadians to do who are symptomatic is to stay home. So that test itself doesn't change that recommendation. So I think that's the other way of looking at it. Will that test change what happens to you in terms of your health management? And right now it would not. So everyone who is even mildly sick should be staying at home and definitely distancing themselves from others.
I think we're running short on time. On commence à avoir un manque de temps. Ashley, last question.
Can I just finish one thing is that I will be talking about some of our efforts and looking at the antibody tests in the coming days. So that's later on if you want to detect the level of immunity in the population because people hadn't been tested, they've just all been staying home. That's a different kind of study. So it's a sort of layered approach to determine what exactly is happening with that outbreak in our communities.
Can you tell us a little bit about the stockpile of medicine that we have? I know there isn't a treatment for COVID-19, but there are things like antibiotics, antivirals, things for pain management that are being used. Can you tell us about the stockpile and if we do have enough in Canada here alone right now to treat people?
So I think supply of medication is something that has to be monitored in real time. And I think at the federal level, Health Canada coordinates and requests manufacturers to tell them if things are in short supply. So these are the regular systems that we have. At the different sort of levels of government and people who look after the actual health systems have those supplies. So I think at the federal level, we will have to help detect signals and find everything that we can to get those supplies in. There's many mechanisms in terms from the regulatory perspective in getting medicines. Some of them may not even be licensed in Canada, but can be coming through emergency use. At the federal level, I just want to be very clear that our stockpile is a very, very specific one that is targeted towards some very unusual pathogens like smallpox or Ebola. It is the provincial jurisdictions that have maintained those supplies of regular medications and in our sort of pharmaceutical system. So I just don't want people to get the wrong impression that the national emergency strategic stockpile is where their medicines are. But we do have a very key role in monitoring all of those things that Canadians need. And many other departments can also help in making sure that we have what we need.
You're in constant communication with the provinces and territories and their medical officers of health there. Have any of them flagged to you that they could be facing a shortage of these types of medicines?
I think that's a question that Health Canada might be better to answer. But so far, I think people are flagging certain medications like asthma medications and others where we have to keep a close eye on supply.
Merci. C'est ce qui met fin à la conférence de presse. That's it for today. Thank you very much.